Data-Driven Decision-Making in Nursing by Heidi Johnston. This is for Week 7, Lead 6293 with Dr. Amalio Neves. The objectives for this presentation are to communicate concepts of data-driven decision-making in nursing and how that impacts the educational facilitation of learning, nursing in particular, and higher education. I will do this by utilizing 3 professional articles to illustrate the role of data in nursing decision-making. The first article by Yost et al. Is on knowledge translation of strategies for enhancing nurse evidence-informed decision-making. The second article is the role of expert judgment in statistical inference and evidence-based decision-making by Brownstein et al. The third article by Shane et al. Are going to discuss the barriers associated with evidence-based practice among nurses in low-middle income countries. Within those 3 articles, I will not only discuss the articles themselves, but how they translate into the barriers and advantages for utilizing data-based decision-making, not only in nursing, but in nursing education. Lastly, I will describe in personal reflection the use of data-driven decision-making within nursing education at my organization. Nursing concepts of data-driven decisions. Data-driven decision-making is important in life, in business, in education, and in healthcare. Nurses use data in all aspects of providing patient care and decisions regarding resource management, patient assignments, educating new students. All of this encompasses the use of data to drive decisions for their optimal well-being. When we talk about data-driven decisions in nursing and healthcare in general, we also utilize the verbiage evidence-based decision-making. So those may be interchanged throughout literature. You will see data-driven decisions, but it may also be seen as relevant as evidence-based decision-making. In nursing education, we talk to and drive forth this concept that what we do is not based on what we've always done. We need to utilize evidence-based and current evidence-based findings to drive practice. Not only will it drive practice in the care of patients, it drives practice in the financial application of healthcare, but it also should drive the outcomes of education. If we try one practice and it's working for us, but evidence says that we could impact education more, then we need to look at those evidence-based decisions to make changes or stay the course. I think there's a lot of factors that go into creating change beyond what we see in evidence-based decision-making in healthcare and in education. And we'll talk about that a little bit later through this presentation. Within nursing, we see how evidence-based or data-driven decision-making is utilized. Data decisions are based on having data that is valid, that is reliable, that is transportable, meaning that you have and maintain a workload of data that provides the same results across units and across organizations. This transparent classification as a product of data that has been determined or described in literature is how we move this forward. In education, we utilize models and theories to move education to meet the clinical objectives set forth by boards of nursing in higher education so that students may qualify to meet their minimum standards to sit for licensure. However, there are confounding factors that data-driven decision-making, especially in nursing, run up against. For example, we may have 2 sets of standards in healthcare. We have those that are uninsured, low insured, heavily insured. And unfortunately, there are times where data-driven decision-making is based on the affordability and patient location. We also have to be mindful that many times data is not available for the clientele that we are taking care of. Example of this is in the neonatal intensive care unit, where most of the pharmaceuticals and treatment modalities are extrapolated from evidence-based factors in adult models. Frankly, no one is going to allow you to test theories and test medications on patients that are the most vulnerable. And because of that, we use an extrapolation or an inference in attempting to utilize evidence-based data in making and driving healthcare. Lastly, we need to identify the value in data. Because it works at one place doesn't necessarily mean that it's transferable to another. Again, we talk about that in the neonatal population. So in nursing schools that are specialized in baccalaureate degrees versus nursing schools that start at an entry level at an associate degree, data may determine that the best outcome is this straight linear path. However, we have to make sure that when we are looking at data, we are truly comparing apples to apples and oranges to oranges. Wood 2015 denotes that in particular, that you have to look at the effectiveness and the workload in order to measure the outcome variables that you might see in different settings. In our first article, Knowledge Translation Strategies for Enhancing Nurse Evidence-Informed Decision-Making, a Scoping Review by Yost et al., looks at a review of what strategies nurses effectively use to promote evidence-based data to drive their knowledge, their skills, and their behaviors. In looking at this article, it is evident that nurses absolutely use evidence-based research to modify their patterns of care to drive patient outcomes, positive patient outcomes. And there's a significantly high number of studies that were conducted in this review to show that nurses utilize evidence-based data or data-driven information to drive higher levels and better patient outcomes. The next is the role of expert judgment in statistical inference. This article was an interesting article that I thought was timely, as many times we hear, not only in nursing but in education, why do we do this? Because this is how I was trained. Why do we take this path? Because this is how we've always done this path. It is that expert judgment and statistical inference that we need to really look at. If we follow a leader who has not changed their process due to evidence, then how do we know we are being the most clinically relevant and the most educationally relevant one can be? This article looks at how we utilize expert judgment and how it impacts statistical inference. If we have knowledge, if we have current data-driven knowledge, evidence-based information, and it is different than what our experts state, then we need to take a look to see why we have this dichotomy of what our expert judgment is and how we statistically infer it to our ability to make an informed decision. Does this role of expert influence our decisions? I think they absolutely do. If we look within higher education, we know that the way that the dean or the chairs of departments motivate staff absolutely correlate to how they were trained. What their priorities are based in their leadership modalities. Yes, experts influence the data. In the last article, Barriers Associated with Evidence-Based Practice on Nurses in Low and Middle Income Countries, a Systematic Review. really looked to identify how nurses can apply data when, or how do they apply data in low and middle income countries. Within these 16 articles, which were analyzed, the three main themes were institutionally related barriers, interdisciplinary related barriers, and nurse-related barriers. The theme which jumped out to me in this article was that as it related to interdisciplinary barriers, and it broke down into subcategories that included lack of communication between academic and clinical practice environments, inconsistency between education and practice in the nursing discipline, lack of teamwork, and the public's negative image about the nursing profession, which is interesting. Again, this is in low and middle income countries. What we are finding is that there is a disconnect between how nurses care for patients in low middle income countries. We also know that in different countries, the nursing profession are held in different regard. What happens is that nurses who come from the United States to help in low and middle income countries, research shows that their ability to practice at the same level is hindered, and many times cut corners in making those decision-making based on data. My personal reflection as it pertains to utilizing data to making decisions within my organization. It is absolutely an integrated part of how we make decisions, from creating a mission and vision that are in alignment with the current standards of the BLM movement, and looking at how to intentionally embed information and substance into our nursing curriculum, are all reflected and are all based in data to drive the process. I utilize this personally in our mixed reality simulation, our high fidelity simulation, as well as working closer on intentionally embedding a more social, emotional connection with my students, creating different assignments, which allows for personal reflection on process, very difficult practices we have in the hospital currently. I think that data is driven, and this resource through these three articles look at institutionally in nursing how we drive data, but also the utilization on how I personally drive data through the use of evidence-based. What I learned as a nurse 30 years ago is completely on its head on what I do currently. It is important that we stay not only personally accountable to current evidence-based practice, but teach our students that practice is forever changing. Practice is forever looking for data to support the best patient outcomes, the best financial impact, the most applicable use of medicine. We talk about this on many platforms, but in education within nursing, the ability to use data to drive outcomes, to legitimize our profession into an actual profession, is where data fits in the greatest. This presentation utilized these references. Thank you.